Welcome to Hegde's Implant Care, reliable and predictable implant solutions for all. Today I have a case of smile designing. In other words, I would say full mouth rehabilitation to be very technical. You can see the picture there. This is a 16-year-old girl who has come to me in this particular condition, where you can see the teeth has not erupted fully. You can see just about 1 to 2 millimeters of teeth is visible, and there are a lot of deciduous teeth inside, and plus if you see the gums also, the gingiva is highly pigmented, very dark and very thick, highly unaesthetic appearance. The patient complaints was basically she needs something, she needs a good smile and she needs something to bite. You can see the picture there again, that the teeth are not really occluding, upper and lower teeth do not really occlude. There is a lot of space because there is hardly any teeth left in the mouth, all are submerged. So, this is something we have to handle, a very challenging case. If you take a look at the X-ray, you can see this is a 16-year-old girl, which means that all the teeth should have erupted, but in the X-ray you can see that most of the teeth are still inside in the jaws there, and they are very much deep inside, and we have done some basic assessment, and we have tried to see if the tooth is going to come out. So, finally we realized that this teeth is not going to come out, it is going to stay there because the time for eruption is over, and the formation of the teeth also is not really complete inside. The teeth, whatever is inside is not really complete, so which means it is not going to come out. So, then how do we go about this case? One option was to go for implants, remove all this because this whatever most of the teeth are deciduous there, which means it is going to fall off in some time, and then the teeth is not going to come out. But the solution of implants was not really possible because there are a lot of teeth inside, and these teeth could not be removed because in the jaws we have some vital structures, we have some nerves inside, we have some sinus on the upper, all these areas. So, these teeth was very close to all these structures, which means that we could not remove it and put the implant there, not really viable for this particular case. So, we opted out of the option for implants. So, how do we go about this case? So, what we planned was, first we have to make the teeth little longer, so there is some amount of teeth which is visible. So, the teeth has to be corrected, so that visibility has to be achieved, and the gums have to be corrected, the gingiva has to be corrected, which means that just take a look at the picture how we have corrected the gums. We have done a procedure called crown lengthening, wherein we have increased the length of the teeth, increased the length of the crown. So, we have done a surgery to the gums, it is a periodontal surgery, we have done surgery, we have just opened up the gums a little bit, but in this case was very severe. So, we had to trim the gums with the trimmed gingiva along with the little bit of bone. So, we had to shape the gum, we had to shape the bone inside, and we had to get the teeth out. You can see there we have done the crown lengthening. Along with crown lengthening, the next issue was very dark colored gums, very highly pigmented gingiva. So, there is a procedure called depigmentation, wherein all these pigments are surgically removed. The depigmentation was done. You can see now from the very dark thick gingiva we have come to almost near normal light colored gums, and again the gum shape has been achieved. Now, once we have done the surgery, now there is a tendency for the gums to grow back. So, whatever we have achieved, sometimes it closes. So, I have given a temporary, these are not in the right shape, but this temporary crown or bridge is just to maintain the gums in the same state. Whatever we have achieved, we do not want to lose it. So, we have done the gum surgery, we have placed the temporary crown and bridge, and we have waited for about 2 to 3 weeks. So, in 2 to 3 weeks, some kind of gingival architecture I have been able to achieve. So, now the problem with the gums is solved now, and also the problem with the visibility we have solved to some particular extent. The next issue was all the deciduous teeth. Now, so many deciduous teeth are there with absolutely no root, like we have seen in the X-ray. So, all these deciduous teeth or the milk teeth, we cannot keep it there because it is going to fall out. If I am going to design something permanent for the patient, I have to think of long term and have to remove all the teeth which is going to fall off. So, we have removed all the deciduous teeth, and finally, we are just left with in the lower arch, we are just left with 4 teeth in the front, that to be just about 2 millimeters height, and we have 2 teeth in the behind, one on either side. So, this particular this is the situation now. So, the upper now we have managed with a fixed partial denture. We have given bridge because some teeth were little strong in the upper. So, we managed to give a full bridge for the upper. The entire arch we have given fixed bridge there after correcting the contours. And so, how we have managed the lowers? For the lower bridge, what we have done is, if I do the same bridge for the lower entire arch from one side to the other side, now the bridge is going to fail because the teeth are so small, and such small teeth, if I give a bridge which has to support the entire arch and the patient bites on it, it might last not more than 6 to 7 months, because the bridge will break along with the tooth, because just the small teeth cannot take the entire load of biting, it will just snap out or it might just break. So, how we have managed this? You can see in the picture there, what we have done is we have given crowns for the front 4 teeth, and we have given crown for the last teeth, the molar teeth we have given crown. This particular bridge, we have joined it with a bar. You can see there is a thin bar running from one end to the other end. So, what is the job of this bar? Now, what this bar done is, the bar has got a clip, and I have done a denture there, a removable denture with a metal frame. Now, this particular denture, it snaps onto the bar. So, it is basically, we call it a precision attachment. In dental terms, in technical terms, we call it a precision attachment, wherein I have given bridges in the front teeth and the back, I have connected with the bar, and I have given a removable prosthesis which has got a clip. So, what the patient has to do is, she has to take this particular clip, place it on the bar and snap it. Once you snap it, it stays in the mouth. So, what is effectively happening is, when the patient bites, the load of the biting, it falls little bit on the teeth because the bar is there, and then major part of it goes on to the tissues, whatever tissues are there in the mouth, the ridge. So, the load is transferred, it is shared, the natural teeth and also the gums. So, the entire process will not break down. So, this is how we have solved the mandibular arch or the lower arch. I have given fixed partial denture and a precision attachment with a removable partial denture. This is how we have. You can see in the final picture there, which has been, you can see what we have achieved there. We have achieved beautiful gums there. We have got a good natural looking dentition for the upper. We have got a relatively good aesthetically pleasing lower arch also we have tried to manage. If you just compare the before and after of this case, you can see the difference. Now, this particular photo is taken maybe about 3 years post placement. Once I have done the treatment, this particular photo is it is taken after 3 years post finishing the case. So, you can just appreciate, I have been able to achieve length of the tooth, we have been able to achieve a correction of the color of the gums, we have been able to achieve the shape of the gums. For the lower arch, for the lower jaw, I have been able to give all entire component of teeth, which was otherwise really not very difficult. And most importantly, if you can take a closer look, if you see that when the patient is biting, there is contact between the upper and lower teeth, in which was not the case before you started. That is one very important thing, that the patient in this particular case is able to chew and grind properly. So, this is what we achieved. So, this is how we have achieved a effective smile in this particular case, and also effective mastication or grinding is possible. Thank you for a patient hearing.